Hello, my name is Dr. Comerci. I am a dentist here at Integrity Dental, and we are looking forward to talking to you today about sleep apnea. It's something that we get a lot of questions on here in our practice, and a very important issue that it's good that you have some information about. So to start, what is sleep apnea? Well, sleep apnea is a very common condition, unfortunately very common and growing in how common it is here in the United States. A condition where you go to sleep, the musculature in your neck and your face relaxes, and that airway that you have slowly closes to the point where you have trouble to breathe. And in certain types of sleep apnea, it'll actually close completely and you cannot breathe. Now you're sleeping. A lot of times patients aren't aware that they stopped breathing, but your body has to wake itself up to increase that tone, the tightness of your muscles in order for that airway to open back up so you can continue breathing. And so it's a cycle throughout the night of trying to go to sleep, falling asleep, the airway closes, you stop breathing. Subconsciously, you have to wake yourself back up for the airway to open up again, and you start breathing again, and you just go in and out of that throughout the night. There's different levels of sleep apnea. Some are very light and have practically no symptoms, but do have an effect on your body, all the way to very severe sleep apnea, where sometimes you're stopping breathing for several minutes, and the quality of your sleep is very poor, and you do have symptoms. You have headaches in the mornings, you can wake up feeling very unrested, very fatigued throughout the day, having moments throughout the day where you're driving, watching a movie, doing something at work where it's a quiet moment and you just feel like sleeping. So it's very common, and it is something that we're seeing more of, and it's very important that you understand this, particularly if you're having some of these symptoms, where you can have it evaluated and treated.
Dr. Comerci, who is at risk for sleep apnea?
Who is at risk for sleep apnea? Well, there are certain things that kind of tip us off to patients that may be more likely to have sleep apnea. Unfortunately, simply being male, males tend to have more commonly have sleep apnea. Also, the size of your neck. So men being bigger, of course, have bigger necks, but in general, anybody that has a larger neck or struggles with obesity, so the larger you are, the more obese you are, the larger your neck is, the more weight there is on your neck and your jaws when you lay back and you go to sleep, the more likely that airway will close. So people that are overweight tend to have more likely sleep apnea, and some patients that just by nature have a smaller airway. Different people are different. Some people have big airways wide open, others just by nature have smaller airways. And patients that smoke tend to have a higher degree of sleep apnea. But if you have none of those characteristics, you can still have it. So it's interesting. You can see a very slender, athletic female and still have sleep apnea. So there are certain things we look for that tip us off, the big ones being male and having a large neck circumference. But there's other things that kind of could come into play as well.
How does sleep apnea affect my oral health?
How does sleep apnea affect oral health? That's a very good question, and one that we're constantly evaluating. When you come in for a new patient exam at Integrity Dental, or for your periodic exams for that matter, we're looking for certain things that would clue us in to potential airway concerns. So how does sleep apnea affect your oral health? Well, the first thing is, as you're sleeping, you're not breathing well, and so you tend to open your mouth more to breathe, where in health, you really should be breathing through your nose when you sleep. That's very important, and it helps a lot filter the air, it reduces allergies, it helps you sleep higher quality. So the first thing is you tend to open your mouth. You don't take advantage of the physiology of the nose, of breathing through your nose. And by opening your mouth, you tend to be drier. Now, bacteria like a dry environment in the mouth. They like that drier environment. Saliva is very protective against cavities and against diseases of the gums. So when you're dry, it puts you at risk for increased risk for cavities and things like gum disease, gingivitis, periodontitis. So those are the two things right off the bat. It could be increasing your risk for gum disease and your increase for cavities. The other things that sleep apnea does, unfortunately, that affects the mouth, is when you're coming in and out of those layers of sleep. You don't go down and sleep well and wake up later ready to go for your day. You're coming in and out of the various stages of sleep, and that causes some spasming of your jaws. So we see that patients that have sleep apneas tend to clench and grind their teeth more. So of course, if you're clenching and grinding your teeth, over time that wears the teeth down. We see a lot of fractured teeth. Of course, patients don't like how that looks. Fracturing front teeth or teeth that are viewed in the smile isn't aesthetically pleasing. So we end up doing a lot of dentistry to repair these things. And really what we try to look at is, okay, we can fix them, but what was the cause? And we always try to step back and find out what was the cause. And if it does have to do with sleep apnea, we try to address that. The other thing that patients do with sleep apnea is as you're sleeping, you're laying in your bed, often on your back, your airway closes. Subconsciously, your body will try to open up that airway. And that one way it does that is by jutting the lower jaw forward. So patients subconsciously, unbeknownst to you, can be sleeping, not breathing well, and your jaw will jut forward to try to open that airway. And by doing so, those teeth can rub forward and back and wear each other down or chip. So oftentimes having a specific wear pattern on the front of your teeth can be a hint that you have sleep apnea. In addition to all that, you can have issues with your jaws. From the clenching and the grinding and those abnormal movements can give you muscle pain in your jaws and cause actual issues with the joint because of the wear that you're putting on your joints every night.
What about mouth sores or gingivitis?
Yeah, well, mouth sores, kind of from the same thing. If it's your mouth is real dry, it puts bacteria and actually certain types of yeast have different opportunities to take over and cause mouth sores. And then the gingivitis, yeah, we touched on with the gum disease.
How can a dentist help diagnose and treat sleep apnea?
Very good question. So thankfully, I feel very privileged. As a dentist, I'm able to screen for sleep apnea. I may not be always the one that can help treat it, but I screen for it. And we do that with every new patient. And again, at our periodic exams, we're constantly checking on it, having conversations about it. So one of the ways that a dentist is in a great position to evaluate this is we're constantly looking in your mouth, of course, and actually evaluating the airway. So when I see a new patient, I look, one, at the soft tissue first. So I'm looking at the cheeks and the lips and, of course, the neck circumference and evaluating things from the start about how the airway is. And then, of course, I can sit you back, open your mouth, ask you to stick your tongue out and see the airway. Some patients have a very restricted airway, higher risk for things like sleep apnea. Some patients, it's wide open, seeming like drive a truck through it. That's great. Others have tonsillar problems, some big overgrown tonsils, and it's including that airway. You may have a decent airway, but the airway's obstructed by the tonsils. So there's some things right off the bat that we look for. Also, the size of your tongue. Everybody's different. Some patients have small tongues, some patients have big tongues. You have a really large tongue, that makes it harder to breathe when you relax because there's just less room. Also, the size of your jaws. Some patients have big jaws, some patients have small jaws. Some patients have bony growths that make less room for the tongue. All that could potentially push that tongue backwards, make it difficult for you to breathe or increase your risk for sleep apnea. So a dentist is in a great place to evaluate the sleep apnea just by virtue of those soft tissue things. And as what we've mentioned with the teeth, we're looking for certain wear patterns, certain things on the teeth that tip us off to, there's some extra grinding, clenching in certain ways that may be affecting the breathing or may be a cause of poor breathing, sleep disordered breathing. And when we take a medical history, we go through all those things. Do you wake up with headaches? Do you struggle with morning fatigue? Those kinds of things all tip us off to a conversation that we can have with you regarding sleep apnea. Now that is just the beginning. As a dentist, I often don't treat sleep apnea. I'm not the person who will actually help you get this treated if you need it, but I can coordinate the care. So the first thing I will often do when I'm suspicious of sleep apnea is make a recommendation that the patient would see a physician, a sleep medicine doctor, to have it formally evaluated. And thankfully, we have a very good team here in Pueblo that we refer to often that are very good about getting our patients in, being evaluated, and discussing the treatment options to sleep apnea. So most of the time, I won't be the one to actually help treat the sleep apnea, but I can very much help coordinate evaluation, diagnosis, and then from there, the physicians can treat it. Most of the time, sleep apnea is treated with what's called CPAP therapy. So CPAP is a mask either over your full face or over your nose that forces air into your airway that helps maintain that airway open. So even if that musculature relaxes and tries to close down and the airway is in risk of compromise, that forced air helps maintain it open and you can breathe well throughout the night. Now, CPAP is still viewed as the standard of care or gold standard for the treatment of sleep apnea, but honestly, it's sometimes very difficult to tolerate. So some patients tolerate it well, have no issues with it. Others cannot imagine the thought of sleeping with a mask and hoses connected. And so then, thankfully, there are other treatments available. Your physician should discuss with you certain surgical options. Sometimes it's tonsillectomy, removing the tonsils to make more room. Sometimes there can be a tongue reduction. Sometimes there can be other soft tissue surgeries that open up the back of the mouth, increasing the airway. Sometimes it's a conversation about weight loss and additional exercise and diet. And there's some cool new things that are being done where little implants are being placed in various places that stimulate those muscles while you sleep and don't allow them to fully relax. so that tone is maintained in the muscles and the airway is maintained open. So all that would be handled by the physician side, but the cool part is sometimes I'm able to step back in to this care as a dentist and help treat your sleep apnea. And the way that we do that is through what are called oral appliances. So an oral appliance is something that you would wear while you sleep. And typically there's an upper member that goes over your upper teeth and a lower member that goes over your lower teeth. You pop it in before you go to sleep, and then you go to sleep. And this oral appliance, what it does is it helps maintain your lower jaw in a forward position. So again, as the problem with sleep apnea is often you go to sleep, everything relaxes and everything falls backwards. It falls with gravity backwards and the airway closes. But we found that if we can maintain this lower jaw forward with an appliance that you wear while you sleep, sleep apnea is often treated well, or at least often you have less occurrence of sleep apnea. So we can make, and we do make, oral appliances for patients, and there's a myriad of ways that these can be made, different designs, and there's always new ones coming out. We can make them as thin as possible to make them as minimally obtrusive, very easily cleanable, and very easily maintainable and adjustable. So we've gotten it down to where we can do these quickly and as minimally intrusively as possible for the patients. So if you have any interest in seeing those, please feel free to come in and we can show you different models. You can look them up online. And the oral appliances are often made also with a guard on top of them. So if there is still some sleep apnea going on and there still is some grinding going on, it protects your teeth and your joints. So I think we covered it. Yeah, so that's how a dentist could potentially be involved in sleep apnea, primarily through evaluation, secondarily through referral and coordinating good care from the medical side. And in certain cases, I can jump back into care and help you by making an oral appliance that you would wear here. And that particularly applies to patients that cannot tolerate CPAP therapy or the real light sleep apnea, mild or moderate sleep apnea. The oral appliances work well. There's some studies that'll show good support that mild and moderate sleep apnea are treated practically equivalently with CPAP therapy. So it's a good alternative, but there's of course risks and benefits to each that we want to go over and make sure that your physician is on board. Of course, the physician gets to decide how to treat sleep apnea. They're the driving force and how this would be done. I can just simply come along as a dentist, come along the physicians and make an oral appliance when appropriate and support you from that regard.
I think you touched on this, just maybe refer back to the previous question. What treatment options might a dentist recommend for sleep apnea?
Sure, so to summarize again, what treatment options might a dentist recommend for sleep apnea? Well, the first thing, of course, is it must be evaluated. Patients will sometimes come in saying, I snore. I've heard dentists can make a snore guard. Well, that's fine, but unfortunately snoring can be indicative. Actually, in 80% of the cases, patients that snore do have some amount of sleep apnea. So I'm not usually willing to make a snore guard until we've ruled out sleep apnea because that could be there. So the first thing a dentist would do, to step back, would be evaluate. The second thing a dentist would do would be to coordinate appropriate referral and evaluation with a physician. Now the physician gets to determine what is the best course of action for sleep apnea. In certain cases, that best course of action is an oral appliance, in which case a dentist can go over, do you have healthy enough teeth and gums for an oral appliance? Okay, then what type of oral appliance would be used? There's different types. And then of course, what are the risks and benefits? How does it work? And then we jump into oral appliance therapy.
Can oral surgery help me cure sleep apnea?
In certain cases it can, yeah, and we touched on that a little bit, but sometimes the issue is simply the size of the airway or perhaps the size of the soft tissue. So oral surgery can help in certain cases, like say you have really inflamed large tonsils. Well, sometimes removing the tonsils, a tonsillectomy, working with an ENT doctor is enough, and that solves it. Sometimes the tongue is an issue. Sometimes the actual physical size of the airway opening itself can be expanded. So there are certain oral surgery or certain surgery options that do help with sleep apnea, and we briefly touched on a device that goes as implanted in the soft tissue and helps maintain the tone of the muscles to keep that airway open. So sometimes surgery is the right option, and your physician should go over that with you after appropriate evaluation.
You mentioned this already, but can you just reiterate what appliances do dentists recommend for sleep apnea?
So yes, appliances that dentists will often recommend in appropriate cases for sleep apnea are very simple. They're called oral appliances, or a mandibular advancement device is another word that's used, or a continuous open airway therapy. A lot of different words are thrown around, but basically an oral appliance, something that you would wear while you sleep. An upper member that clicks in or adheres to your upper jaw, a lower one that clicks in or adheres to your lower jaw, and then there's a rubber band or different devices that'll hold them together and maintain that lower jaw forward. So a dentist would I would potentially make for you what's called an oral appliance, which would help keep that lower jaw forward in a healthy position to prevent the collapse of the airway while you sleep.
How can I schedule an appointment to talk with a dentist about sleep apnea?
Yeah, great question. How can we move forward? If any of these things kind of strike home with you, or you feel like, ooh, this could be me, the next step I would recommend is giving us a call. You can reach us at 719-545-2456, and we would, 2468, excuse me, 719-545-2468. So you can reach us at that number, and we would do what's called a comprehensive exam. So we would talk through your medical history, talk through your concerns, do a very good oral exam, and then from there we would know where to go. And probably it would involve an evaluation by the physician from there.
Call to action.
All right. So I hope this video was helpful. There's some good information here regarding sleep apnea and the way that it's treated. If any of this is interest to you and you think that this may apply to you, please give us a call. We work very hard at getting patients in quickly for exams, and then we work very hard at doing very good, thorough exams and explaining everything we find. So if this could potentially apply to you, give us a call one more time, 719-545-2468, and we'll line you up for a cleaning, line you up for an exam, and do a very good discussion of everything we find, and we'll take it from there. Thank you.